Namaste and Radhe Radhe and very warm welcome to everyone on behalf of JKYog, Radha Krishna Temple of Dallas and Swami Mukundananda ji. Friday evenings are special with our Friday webinar series brought to you by JKYog Online. And today, as always, we have a very important topic on tips for keeping a very healthy heart. And talking about this important topic today, we have Dr. Rumit Thakur. He's joining us. Dr. Rumit Thakur, he did his undergrad in University of Texas at Dallas and Medical College at Midwestern University. He did his residency program at University of Texas Health Science Center Northeast. Dr. Rumit, very interestingly, has worked in IT industry for more than 7 years. Yes, he is a master of all trades, I would say. He has worked for companies like Texas Instruments, General Electric, Verizon Wireless, and many more. And he has also worked as a physician at Christus Good Shepherd Medical Center, Charlton Medical Center, and currently is working at Baylor Scott and White Medical Center. Dr. Rumit was awarded top analyst for 6 months consecutively at Texas Instrument. He has also received first prize in quality improvement project for the entire state of Texas. He was also awarded Teaching Faculty of the Year award at University of Texas Health Science Center Northeast. So very happy and very grateful to have you, Dr. Rumit Thakurji, for talking about this very important topic on maintaining a healthy heart. And I also want to take a moment again on behalf of JKYog to thank Dr. Bhal Kandalwal ji. He has been instrumental in setting up all these beautiful health webinar series that JKYog brings to you every Friday. With that, I would now pass it on to Dr. Rumit Thakurji for uh, uh, leading the webinar today with his wonderful presentation. And after that, we will have the Q&A session. Over to you, Dr. Rumit ji.
Okay. Thank you so much for allowing me to be part of this and giving me the opportunity to be able to share the knowledge and make a society a better place for everybody. So today's topic, let me share my screen. So we are going to be talking about healthy heart. So the key to selecting this topic is, as a physician, we go through this day in and out, and uh, many people have cardiovascular diseases are the leading cause of death worldwide, and I know a lot of times whenever family members are suffering from a disease, we tend to do not have any idea of what's going to happen next. And so I want to take this opportunity to educate everyone what goes through our mind and how do we take the action to treat the patient. So with that, I begin. Again, as I said, cardiovascular disease has been the leading cause of deaths in developed nation and worldwide, actually. And those include coronary artery disease, which strokes and peripheral arterial disease. Coronary artery disease is basically, you've got a heart, and if it has any blockages in the arteries that supplies the blood to the heart, then people tend to have a heart attack. So that's what it is. The strokes are when you have similar phenomena happening, but it actually happens in the brain. And peripheral arterial disease is a disease process where this occurs that involves your or arteries in the legs, hands. A lot of people have those diseases, and similar disease processes happens. So many times we want to. So objective of this talk is to actually explain everyone that what causes the chest pain. Differentiate between how do we differentiate between, is this chest pain coming from the heart or is it coming from any other source? what is myocardial infarction, what is coronary artery disease, how do we treat the myocardial infarction, what is PCI, which is percutaneous coronary intervention, and what is CABG, which is coronary artery bypass graft, which medications are important to take when you are suffering from such a disease process, and how the most important of all is to how do we prevent these cardiovascular disease, what can we do to prevent it so that we could all lead a healthy life. Many times, whenever our family members complain that I'm having a chest discomfort or I'm having a chest pain, we tend to panic a lot. So basically, and in order to be able to help them, I think we need to be able to differentiate: is it truly coming from the heart? Is it coming from any other source? So that's what my goal is going to be. So basically, what is pain? Pain is a discomfort or distress, or it's an unpleasant sensation that there's something is wrong. And basically, chest, we in our chest, which is the upper part of the body, and that has, we have our chest, we have a thorax, which is the area of the chest, which that's where the lungs and heart and all the other organs are. That's basically a upper part of the body. So whenever somebody complains of a chest pain, we want to make sure which there are chest pain that causes the life-threatening conditions, and there are chest pains that are coming from which are not life-threatening. So we should be able to differentiate that. So whenever we're going through that, we have these. We typically, as a physician, we think about what steps to take further. So the few things that causes the chest pain that would be life-threatening, those are basically having especially acute myocardial infarction, which would be spending the majority of the time on that. Then which is somebody, which is simply put, it's just when we say it's a heart attack and somebody's having heart attack, that's what myocardial infarction means. Then there is aortic dissection, which is a big artery that actually comes off of your heart and actually tears open. That can also potentially be a very serious condition and can take your life. Then there's also a condition called pulmonary embolus, which is you've got a blood clot in your pulmonary artery, which actually comes from the heart and goes to your lungs. And then so sometimes there are blood clots there, and that can potentially also take your life. And then there is a condition called tension pneumothorax, which is a tear in the parenchyma of the lungs, and then that causes the air buildup in your chest wall, and that collapses your lung because of the pressure. So that can potentially also be very catastrophic. And also we have a esophagus, which is we call that's what connects your mouth to the stomach. Sometimes that tends to rupture and tear open, and that also causes the chest pain. So whenever we're dealing with the chest pain, those are the things that we usually think about, because those can be serious. And what can we do to differentiate that? What can patient do to help their family members? Then there are other causes that causes chest pain, which are not life-threatening. They can be managed. They can you don't have to take immediate steps. You can basically wait, and then you could follow up with your primary care doctor the following day. Those includes having basically having a rib fracture, for instance. So sometimes when we fall down and we fractured a rib, they can be very painful. Sometimes you may end up going to the emergency room, but that's not as catastrophic as the conditions that we discussed above. Then there is also something called costochondritis. What basically that is the chest wall pain. Essentially, it's the inflammation of the swelling of the chest wall and that can mimic that you're having a chest discomfort. And many times what we do is typically whenever somebody complains of a chest pain, we say, okay, where exactly are you hurting? And they say, oh, it's hurting in my chest on the left side or the right side. When we say, okay, if you press on the chest wall where it's hurting, can you reproduce that chest pain? So if you press that chest wall and if it's reproducible, that kind of actually gives us a reassurance it's coming from the chest wall rather than coming from the heart. So we call that a costochondritis. And many times we just say, take some ibuprofen, take some naproxen, and those tends to, or take some acetaminophen, that will take care of the pain. So those are not as deadly as the heart attack. Then sometimes you can have a pleurisy, which is the inflammation of the pleura. Our lungs are surrounded by a sac, and sometimes you can have a pleurisy type pain, which is you take a deep breath and you're hurting, and then as you inhale and exhale, it hurts when you inhale, and then exhale, it actually gets better. So that's a pleurisy. So that's also coming from the lungs. A pleura that surrounds the lungs. Then there is something called empyema. That's an infection that can be actually a serious condition and that may require immediate attention, as far as because that's an infection that requires antibiotic treatment. Then our elderly population, typically they have shingles, which are very burning pain on your chest wall. Whenever you have a very burning sensation and you see a rash on your chest wall, those are shingles. So that can be treated in the outpatient settings as well. Then you have a esophageal spasm, where your food pipe that connects your mouth to your stomach tends to spasm. That happens to a lot of people who have reflux, or the people call it acidity. In India, we say, okay, whenever after I eat, there is a burning sensation in my chest wall. And if you have that for a prolonged period of time, for many years, what ends up happening is that your esophagus, since it has gone through a lot of inflammation over the course of time, it tends to have uh, it tends to actually start spasming, meaning it starts contracting, and then you start having a chest discomfort at that time. So that's also what we call that's what diffuse esophageal spasm, or the esophageal spasm is, and that can cause a chest pain as well. Then many times we develop pneumonia, which is an infection of the lobes of the lungs, and those also a lot of times gives you a chest pain as well. So these we've listed some of these disease processes that causes a chest pain, which are not as life-threatening as the condition that are listed above. So that's, as a physician, whenever we're dealing with anybody having a chest pain, that's what we're thinking about. That's what we're trying to decide what exactly is going on and how can we help our patients. So when is a chest pain an emergency? So whenever you have a family member, and then whenever they complain that they're having a chest pain, one of the first thing that we ask is, where exactly are you hurting? And they say, okay, I'm hurting on my left side. And many times when we say, okay, can you characterize your chest pain? Because classically, the chest pain that is associated with myocardial infarction or the heart attack is they have a pressure type sensation. They feel like there is something very heavy in my heart. Uh, they feel like there is, sometimes they say there's a sensation that there's an elephant sitting in my heart. So that pressure type sensation is a red flag. And that's when we say, okay, this potentially can come from the heart. And when they start having shortness of breath, they are not feeling right. They start perspiring, and they start having a lot of sweats. They're short of breath, and they start having a little bit of nausea. They start vomiting. Then you should always be on the lookout, because that's classically how the heart attack usually presents. And then so just that is an emergency, and at that point you should be thinking that, okay, this is heart attack and I need to take an immediate step. um, then so basically, as i was as I was saying, so whenever your family members is suffering from that, that's the number one thing. Uh, the many times we, like we were discussing, we were, so the as the cardiac causes of the chest pain, whenever they're complaining of that, then you should be calling 911 or taking the patients to the emergency department. So I'm discussing some more cardiac causes of the chest pain. Those include angina, which angina is basically a chest pain sensation. So many times, whenever a patient, like I was saying, they were complaining of having those chest discomfort, whenever they say, I have a chest pain, uh, and then they say, then we ask the next follow-up question is, does the chest pain get worse when you start doing any kind of an activity, when you start let's say, for instance, you exerted yourself and you started walking, and they say that the chest pain is actually getting worse with that. And then when we asked another question, what makes it better? And then they say, well, when I sit down, it actually gets better. So we call that a stable angina. So what that means is that whenever you do any kind of an activity or any exertional activity, you start having a chest discomfort, then the likelihood of somebody having a heart disease or having a blockage in their arteries that supply blood to their heart is high. So we call that a stable angina. Then there is also something called an unstable angina, which is as you are sitting on a sofa watching TV and you have a sudden onset of pressure type chest pain that we discussed earlier. That is an unstable angina. So similarly, they both are associated with a heart attack, and those should be taken seriously. Also, some of the other things that causes chest pain is if the patient has had a history of heart attacks in the past and it has led to a permanent damage in their heart, then they develop something called heart failure. There are two types of heart failure that we have. One is a systolic and the other one is diastolic. Systolic is when the pumping function of the heart is actually reduced. Normally, your heart should be able to pump 50% of the blood that comes to the heart, and it should be able to pump it out to provide it to the rest of the body so that the oxygenated blood can circulate throughout the body. And whenever, so in a systolic heart failure, actually the heart pumping function goes down less than 50%. So it's not able to pump right. And that happens a lot of times. Many times it happens because of having a heart attack. There are other reasons that causes systolic heart failure as well, which it's off the topic of the scope of this talk, but and the majority of the time it is because of having a coronary artery disease. Then there is a condition called diastolic heart failure, where the muscles of the heart are too thick, and that happens because of you've had uncontrolled blood pressure, or your heart, or you can have some hereditary condition that also has a thickened heart, and in that case, the chamber, the size of the cavity of the heart is, the chamber is actually small, so the amount of blood that it can fill is very small amount, so it will pump out less. So those are the heart failures we have. Then there are valvular disease that also causes a chest pain, where we have four valves in our heart, and the area of those heart, the valves sometimes are narrowed, so those can also give you a chest pain as well. There is also other cardiac reasons that are chest pain that can cause chest pains are pericarditis, which is our heart is surrounded by a sac. We call that a pericardium in our body. That gets inflamed, that gets infected, and it can actually cause pericarditis, and you can have chest pain from that. Then you have a heart muscles itself that gets inflamed, and we call that a myocarditis. Then there is a condition called endocarditis, which is the infection of the heart valves. So that can also cause chest pain as well. Sometimes a lot of arrhythmias, because the heart has a particular rhythm that it actually beats at. And when it gets out of the rhythm, that can also give us a chest pain. Um, and like I said before, there is a condition called aortic dissection and aortic aneurysm, where the vessel that comes off of the heart actually tears open, and that gives you a chest pain as well. And then there is aneurysm, is a weakening of the aorta, and actually opens up a hollow cavity, and that aneurysm can also give you a chest pain. So whenever we're talking about chest pain, these are the things that we talk about that can be very that can be very deadly for patients. So as I was discussing the heart as the anatomy of the heart is we have a atrium, we have a right atrium, then we have a right ventricle, then you have a left atrium and left ventricle. Normally, the normal function of the heart is to pump oxygenate the blood, and then so basically pump the blood so that every organ in the body gets an oxygenated blood. So the blood returns from the inferior and superior vena cava. It comes into the right side of the heart. From the right side of the heart, it's pumped out into the lungs through the pulmonary arteries, and then lungs is where the oxygen exchange occurs, and then from there, from the lungs, the blood comes back into the heart, and then it's pumped out of the aorta. So, as I was discussing earlier, what exactly is pulmonary emboli? Pulmonary embolism is whenever the right side of the heart pumps the blood back through the pulmonary artery into the lungs, and there's actually a blood clot forming there. So whenever you have a blood clot in your pulmonary artery, the heart has a hard time to pump the blood into the lungs because there is a blockage here. And then that can actually potentially be very bad for the patient. So that's what the pulmonary embolism is. So that a lot of times that actually gives you a sensation that I'm having a chest pain, and people actually get short of breath. Then we have our left side of the heart, where the blood goes from the left ventricle into the aorta throughout the systemic circulation, meaning throughout the body, because the left side of the heart is where the oxygenated blood is, and it actually gets pumped out from the ventricle into the rest of the body through the aorta. And the aortic dissection is a condition where this aorta actually for some reason actually gets tear apart, and it opens up. And that so we call that aortic dissection. That is also a very life-threatening condition as well, and very severe condition. It requires immediate care. So as I was saying, so what causes chest pain? As we discussed, the life-threatening condition, which are cardiovascular, includes ACS, which is acute coronary syndrome, pericarditis, which is the inflammation of the pericardium. That's where the heart is actually that's what holds the heart in our body. Then aortic dissection, and then aortic stenosis, which is a narrowing of the aortic valve, can also give you a chest pain. What are some of the reasons that causes chest pain from the lung standpoint? From the lung standpoint, pulmonary embolism, like as we discussed earlier, having a blood clot in your lungs, in your pulmonary artery, pleurisy, which is inflammation of the pleura surrounding the lungs, pneumothorax, which is the air in the lungs, and the pneumonia itself, that also causes chest pain. There are some pediatric cases where Kawasaki disease and hypertrophic cardiomyopathy, these are congenital disease that causes chest pain. Then there is a gastrointestinal cause of the chest pain. Those includes esophageal reflux, which is the acidity, we call it, esophageal spasm, which happens if the acidity is not treated over the course of many years. Then the esophagus gets damaged from within, and it starts spasming, it starts closing on its own, and that gives you a chest discomfort. Esophageal rupture, which means that the esophagus tube itself actually breaks apart, and that tends to happen on a patients that have a persistent nausea, vomiting. Many times alcoholics have it. So that is also a very serious condition, needs an actually immediate care. Peptic ulcer disease, where you have ulcers because there are bacteria that causes the ulcers. Many people that can also mimic the chest pain. Gallbladder itself, which is located near your liver area, and that sometimes our body sometimes you get pain from that area, and that can also cause chest pain. And pancreatitis is a disease process where pancreas gets inflamed, swollen, and then you get a chest pain or the abdominal pain associated with it. Some of the other causes of chest pain are coming from the chest wall pain, which is herpes zoster, which is a shingles, like we discussed earlier. They have a rash, and then the rash actually follows a particular dermatomal pattern, which means it actually infects the nerve fiber. And as we age, once our immunity goes down, that virus gets reactivated in our body because, as a child, we used to get shingles, and then your body fights it off. Then it actually stays in a dormant state for many, many years because we have a very good immunity and we're able to fight it off. But as we age, our immunity goes down, and then that virus gets reactivated, and it forms in the form of a rash that gives you a burning pain. So that's herpes zoster. Then the costochondritis, like we discussed earlier, where you have a chest wall pain itself. It's the inflammation of the chest wall, not it. And that then you have a cervical radiculopathy, where you have a problem with your neck, and then neck. The nerve fibers goes through the neck to the chest, and they radiate down to your chest, and that gives you chest pain as well. Then there's a rib fracture, which occurs because of the trauma and anxiety. A lot of times we've ruled out everything, every other cause of the chest pain, then many times it's the anxiety level that causes the chest pain. So since we've talked about the heart and what causes a chest pain, we'll go into more about the lungs. So the few things that causes chest pain in the lungs include pneumonia, then there is tracheitis and bronchitis. So a pneumonia is the actual infection of the lung itself, of the lobes of the lungs. Then the tracheitis is a upper part of the trachea that gets infected, and then there is a bronchitis, which is the bronchus that actually gets infected. Then there is a pleural disease, which pleura is the sac that actually surrounds your lung, and there is some fluid collection there because of the pneumonia itself. Inflammation leads to a lot of fluid accumulation in the lungs. We call that a pleural effusion. And then there's air in the lungs as well, which is a pneumothorax that also causes a chest pain. And then there is a pulmonary hypertension where heart is having hard time pumping blood into the lungs because of the increased pressure in the pulmonary artery. That also causes a chest pain. Some of the gastrointestinal causes of the chest pain includes, like we discussed, gastroesophageal reflux disease, diffuse esophageal spasm. Then there is a rupture of the esophagus. We call that a Boerhaave syndrome. And then then you have a hiatal hernia, where basically your esophagus gets above the diaphragm, and you form a hernia there, and that goes into the chest wall, in the thorax. We call that a sliding hiatal hernia that actually causes chest pain as well. Then pancreatitis, which is the inflammation of the pancreas that can cause chest pain. Uh, and many times whenever the gastrointestinal symptoms have a tendency to mimic the chest pain, and many times when we say it's not the heart, majority of the time it turns out to be a gastrointestinal cause for patients having a chest pain. For instance, having an acid reflux or the esophageal spasm. So what are some of the musculoskeletal reasons for the chest pain? Those includes rib contusion or the fracture, especially whenever you get into a car accident or any kind of a trauma. Then you have a rib contusion, you have a fracture in your ribs that causes a chest pain. Then you have intercostal muscles and costochondritis that also causes chest pain as well. And then last but not the least, what are some of the psychiatric cause for having a chest pain? And those includes panic attack, and whenever, and this is a diagnosis of exclusion, or some of our young patients who does the likelihood of having somebody young having a coronary artery disease or having a heart attack is very low, and many times they're suffering from the psychiatric cause, and those can cause chest pain. Not only it happens in the young patient, it also can happen in the adults as well. So, and this is a diagnosis of exclusion, meaning that we need to rule out all the other severe cause of the chest pain, and then if we've ruled out the other causes, then most likely it's coming from a psychiatric reason. The other cause, like as we discussed earlier, herpes zoster or post-herpetic neuralgia. This is our shingles. Then you could have a referred pain where the nerve fibers for the chest wall kind of crosses over or actually supplies the sensation of the pain that also comes from the other part of the body. And actually, there's a single nerve that gives you that sensation, and that's a referred pain. And there are some other inflammatory conditions like collagen vascular disease, lupus, sarcoid, scleroderma, Kawasaki disease, polyarthritis nodosa, and Takayuki arthritis. Again, these are all the diseases that we think about, and that can cause a chest pain. So how do I approach the chest pain? Knowing that all of these condition causes the chest pain, how do, as a physician, we differentiate and what can we do to help our patients? So history is the one of the most important clue, and many times more than 70% of the diagnosis that we make, history helps us out to make the diagnosis. So history is actually very, very important component of our that guides us helps us guide the therapy. So whenever somebody is complaining of the chest pain, we typically ask them, when did this chest pain start? When did you start having the pain? If it's been going on for a very long time versus did it start something abruptly just now? Then we say, what provokes this kind of a chest pain? What brings it on? And what makes it better? So that also helps us out. So whenever they say, well, no, my chest pain, whenever I eat my dinner and right after my dinner, I start having a chest pain. Immediately, then we're thinking, okay, it may not be heart. It can still be heart, but may not, likelihood of being not related to heart is high. So we say it could just be a gastrointestinal cause, as we were discussing. Chest pain occurs not just from the heart itself; it comes from the other areas as well. So then if they say that I've had a I've been coughing and then I've been having shortness of breath, bringing up the phlegm, having fever, then we're thinking about having a pneumonia causing the chest pain. Uh, and so if they're saying that I'm just having a chest pain, it's only hurting in my wall, and if I touch here, it's reproducible, then we know it's coming from the rib cage rather than coming from the heart. So those things, the history definitely makes a huge difference. Then we ask what kind of pain it is, the quality of pain. Can you describe? Is it sharp? Is it dull? Is it squeezing type? Is it a tearing pain? And many times when the people say, I feel like something is rupturing inside, something is tearing open, then that's a red flag for us as a physician, because it is the aorta that's tearing apart. That is a life-threatening condition. It needs an immediate attention, especially our elderly population who are more than 50, 60 years of age, and have history of smoking. So those things are always in our mind. So that's why it's very important whenever we're taking the history, whenever we're asking, okay, when did it start? What makes it better? What makes it worse? Can you describe the pain? Then we say, does it radiate down to the left shoulder, left jaw? That again, that's another red flag that we have. Okay, patients who have a heart attack tends to have these radiations. So we keep that in mind. And then we say, where exactly are you hurting on your chest? Is it on the chest wall itself? Is it a substernal? Is it localized? Is it on the both sides? Is it on the one side? Uh, and then when we say, when we're asking, we're saying, does it come and go? Is it always there? Um, so knowing this history, we call it onset, which is we call it old curve, which is onset, location, duration, quality of the pain, what makes it better, what makes it worse. All those things are very important when we are taking the history. And I know whenever you patients, whenever if one of you have gone and to have a chest pain evaluated, you've seen that we ask a lot of questions. And the reason for asking that question is in our head, we're trying to think about, okay, where this could be, where could this chest pain be coming from? Then the comorbid conditions are also plays a huge role. The risk factor for coronary artery disease includes having high blood pressure, having diabetes mellitus, having history So whenever we ask our patients, do you have any high blood pressure? Do you have diabetes? Do you have any history of peripheral arterial disease? Because if you do, the likelihood of you having a disease in your heart is high as well. Then having malignancy, connective tissue disorder, having valvular problems also sometimes helps us make the diagnosis. Um, we ask them, have you had any recent trauma, any procedures, which is endoscopy or catheterization. Uh, those also tends to help us. And many times the drug use also tends to incite an event where a patient can have a heart attack, and those includes cocaine use, cigarette use, and sometimes you have a family history where you have this in hereditary where uh, patients tends to get a heart attack at an early age, and there are some families that they have it in hereditary. So what is myocardial infarction? So myocardial infarction is an event where you have because your heart, the main function of your heart is to provide the oxygenated blood throughout the body so that all the other organs can function. So heart attack is, so the heart itself is an organ and it actually needs the similar oxygenated blood supply. When a myocardial infarction is an event where heart is not getting an oxygenated blood to maintain the pumping function. There are blood vessels that actually supply oxygenated blood to heart muscle itself, and we have two main arteries that actually come off. There is a left coronary artery and then the right coronary artery. The left coronary artery branches out and provides the blood supply into the left side of the heart and actually gives a majority of major area of the heart, and then the right coronary artery actually provides the other areas of the heart. A heart attack is an event where the blood vessel that supplies the oxygenated blood to the heart has a blockage in it, and that happens over the course of many years. That you start developing a plaque. Plaque is where people who tend to have unhealthy lifestyle ends up having these plaques, and then it leads to a time where it actually completely shuts off and is not providing enough supply of the blood to the heart muscles, and that's when you start having a chest discomfort. And that can potentially, if it does not get a blood supply for a while, it starts that muscle tissue starts dying off, and then the heart starts getting weaker. So that's what a heart attack is. A heart attack is when you have a blood vessel that's blocked, and then the heart is not receiving oxygenated blood in that area. This is a similar, this slide is also doing a similar thing. As you look at it up here, you've got this artery and there is no blockages and the blood is freely flowing. As time moves on, and whenever we lead the unhealthy lifestyle, we start developing plaque. As for instance, we start eating a lot of fatty food, a lot of cheese intake, a lot of red meat, and, eating outside, eating junk food nowadays. That tends to be, we tend to do a lot more nowadays than before. So as the time goes on, and the plaque continues to develop, and then that plaque eventually leads to where there is a narrowing of the the tube gets narrower and narrower, and the more narrower it gets, less of the blood supply, and it tends to cause heart attack after. So now that we've discussed what is heart attack, how do we take care of it? What are the treatments? And the things that we can do is, if you have a family member and the family member complains of a chest pain and describes a chest pain that is classic, and where they're having a pressure type sensation, it's radiating the left shoulder, they're breaking out in sweat, they're short of breath, they're nauseated, that should be a red flag that somebody could be having a heart attack at that point. Then what we do is, typically our aim is to prevent the death. We want to help them as much as we can, and then we want to make sure that the damage that's happening to the muscles of the heart is the least, and we want to minimize their discomfort. So typically the best thing uh, the time is the key whenever somebody's having a chest pain. So whenever you have a family member, don't hesitate to call for help, be it in United States, be it in India, be it in anywhere in the world. Call the emergency, call the ambulance. And so because there are times we need to take action within that time frame. The studies have shown that if we take the action and if the patient gets the appropriate treatment within 90 minutes to 120 minutes, the extent of the damage that's done to the heart is less compared to the more we wait. So as a physician, we have something called door to balloon time that we have to follow, which is within 90 minutes, we should be able to get the patient a help that they need. So whenever the patient complains of a chest pain, and whenever we see that this is probably coming from the heart, and whenever we call the 911, which is in the United States, 911 is a service, ambulance service that we contact. And then the ambulance arrives at the house. And then as soon as they arrive, they do something called EKG, and that EKG sometimes tends to have a pattern consistent with the heart attack. And if we do see such a pattern, then we take them immediately to the emergency department. And once they arrive in the emergency department, uh, and if that hospital has something called capacity to do percutaneous coronary intervention, what that means is that they have a capacity, they have a heart catheterization lab where we go in through the groin or through your hand in your radial artery or femoral artery, and then we do a heart catheterization. When we do a catheterization, we put a dye in your blood vessels, and it actually takes a picture of the heart and then it actually shows us if there are any blockages in the heart itself. And then if we do find it, we can take the catheter to that artery and actually open up a balloon. And then the narrowing of the artery that was there, after when we open the balloon, it actually opens up the artery, and then we put a stent in there so that the blood supply is so the heart starts getting the blood supply it needs. And then we try to do that within 90 minutes, because if we do that within 90 minutes, the damage that happens to the heart is very less, and then the quality of the life that they will have going forward will be a lot better than somebody whom we waited a longer period of time, because the more time we wait, the weaker the muscles get, and then you start developing a heart failure, and potentially it can take your life at that moment. So that's the timeline that we follow. So as a um, as a society, what we need to think about whenever somebody has a chest pain, or family members have complaining of a chest pain, we need to take that immediate step to help our family member out, rather than sitting and seeing that no, this will go away. There are many times when we have a condition where if we're living in a rural America or rural India where we don't have heart catheterization labs within the vicinity where we can take care of this in 90 minutes. And with the advances in the treatments, we now have treatments available where we can give you actually a blood thinner, which will dissolve the clot, and it can potentially help you out. And so that buys you time where later on you can go and have a heart catheterization done at a later time. So there are also those options available, and we use that day in and out. Which medicines typically people should take whenever they have a heart attack? Uh, Whenever they arrive in the emergency department, we're giving them morphine, which helps them alleviate the chest pain. We also give them oxygen, which also helps them out as well. There are medication called nitrites. These medicines tends to dilate the blood vessels, meaning that it actually allows the blood vessels to open up a little bit, even though they have plaque that will help. That's going to help you out with the chest pain. It can even be helpful with the blood flow a little bit. Then we give them aspirin, because aspirin is a blood thinner, and we've known that as a blood thinner because what it does is whenever these plaques are forming, there is a component called platelets in our blood that tends to play some role in it too. So aspirin helps us out because it thins out. It actually it helps out with the process where the plaque is forming. It allows it does not allow that plaque to organize. Then, like as we discussed, reperfusion therapy, where we go in and do a heart catheterization and put a stent in, and then after that's been done, we give them Plavix, and then also we give them a blood thinner as well. Uh, then there's also after we've treated them and after we've given them, after they've got the stent placed, they tend to have other medication like beta blockers. Then there's aspirin and Plavix. Those are our blood thinners, anticoagulants. Then there's medicines for cholesterol, and then we give them another medicine for blood pressure as well. And then we correct the risk factors that needs to be corrected to maintain the healthy heart. So one thing that I would like to say is, once you do get treatment, and let's say for instance you did have a stent put into your heart, it is very important to take the medications that are being prescribed to you by the physician, especially the beta blockers, especially the anticoagulants, and especially the statin medicines, which are your cholesterol medicines, the blood pressure medicines. Um, and the most important thing is to correct the risk factors. So the goal of this talk was to, this is if you had a heart attack and how we treat them, but how can we prevent them? Because a lot of these disease processes that we have, these disease processes can be prevented if we lead the healthy lifestyle. And I think that uh, one of the key component of the life is the healthy life is to be able to follow these. If we follow a very good lifestyle from the beginning, we can potentially avoid having a disease like coronary artery disease. Um, and that's why I want to go over some of the risk factors for the heart disease. So that's what we'll go over now. Those include um, smoking, overweight and obesity, unhealthy diet, physical inactivity, having high cholesterol, which we call dyslipidemia, controlling the blood pressure, and also diabetes mellitus. So these are all the risk factors for having a coronary artery disease. So in order for us to avoid having a coronary artery disease, we'll briefly go into what can we do. So if you are smoking, we've known this for a long time, stop smoking, because smoking not only causes the issues with the heart, it also causes cancer and many other COPD, many other diseases that smoking is associated with. So what can, if somebody was a smoker, what can they do to help them stop smoking? So there are some behavioral therapies and there are some pharmacological therapies that we have available. And and smoking avoidance and cessation is probably the best thing people can do to avoid having a premature death from the coronary artery disease. So people who have a coronary artery disease, a lot of times they tend to ask, I've all smoked all these lifetime, and does it even help me at all that should I stop smoking? And the answer to that question is, if you actually stop smoking, after a few months, it helps you, you can reach, after a few months to several years, you can reach to a stage where you were never a smoker. So yes, it always helps. Especially in coronary artery disease. It also helps in patients who've had history of cancer as well. Uh, so what are the things that there are some strategies that helps in people assisting in to quit smoking. So in order for somebody to quit smoking, if you do suffer from smoking, is to, you need to set a date on as far as, okay, this is it, this is enough, and I want to quit the smoking. And then you can tell your family members that this is the day I'm going to quit smoking, and that's going to definitely help you out. Also, the getting counseling also helps. Having a group therapy also helps. Having a social support also helps. Uh, and many times positive reinforcement makes a huge deal. Those includes if you have not smoked for a long for let's say a couple of weeks, getting a positive reinforcement from your spouses, your friends, your family members, kids, that dad, mom, I'm proud of you, or husband says that he's proud of his wife, that she has, or I mean, the wife is very proud of her husband quitting smoking. So that definitely makes a huge difference. Having a social structure and support where others are on the same boat as you, if you stay in contact with them, having each other, having seen that other person that they're also successful, also makes a huge difference as well. So uh, smoking cessation can happen, and it's with the support of the family, friends, and having a group therapy. Then a lot of times you need to discuss many times when you want to motivate somebody to quit smoking, you need to tell them by if you stop smoking, you can avoid so many disease processes. And when you avoid the disease processes, the quality of life that you're going to have is a lot better than what you're looking forward if you continue to smoke. Then you need to discuss with them the rewards. Those rewards includes improved health, the food tastes better, there is better sense of smell, you're going to save money, you'll feel yourself, you'll feel better yourself. Um, so all of those things, uh, if you go through that, then that's going to help the patient to quit smoking. Uh, a lot of times we have a roadblocks. A lot of people don't have that support. They're worried that they're going to have a withdrawal symptoms, they're going to have a fear of failure, they're going to have a weight gain. So those things are always going to be there. But by having a good family support, having a support from the other friends, that makes a difference. Also, for somebody who does not have that support, there are pharmacological treatments available that you can ask your physicians, and those medications have also shown to help patients quit smoking. Then we have to follow the healthy diet, and the diet is a huge component because nowadays our diets have changed quite a bit. We eat out a lot more than we eat at home, especially be it in India, be it in the United States, be it anywhere in the world. The diet has changed. We typically back in the old days used to eat, especially being Indian, roti, sabzi, and then dal, rice. Those used to be our normal routine, normal healthy food. And our ancestors had it great actually. Our ancestors knew what they were doing when they made. I know a lot of us know what khichdi is, right? So that's a rice and a dal combined together, boiled and made. Whenever scientifically, when you go back and look at it, those dal and rice, when you combine it, it actually puts it's a combination of all the amino acids together. When you have those all the amino acids together, that creates a protein, and that's very healthy for your body. So our ancestors knew what they were doing, and so they had a great way to lead the life. But then as the time moved on, we started shying away from that, and now we're eating all these unhealthy food, and that's what's causing a pandemic of having diabetes and coronary artery disease and hypertension. uh, Last time I went to India, India is a great place, and that's where I come from. My ancestors are there, and I love going there. And I've grown up. Part of my growth was in India, where I lived there for 15 years. And I used to love street food. I would go eat pani puri, but that would only happen once a month. Well, this time, whenever I go back, people eat at home four times a month. And other 26 days, they're eating outside. Not only that, deep fried food, having pani puri and having putting cheese and calorie rich food, a lot of butter, all those use that we've had. I think what has happened is we are inviting a disease processes that will probably make our life very difficult going forward. So if you go back and look at what our ancestors were living, and if you go back to their lifestyle, that is a lot better than actually what we're doing today. And I'm surprised that last time when I went, they offered me a pani puri with cheese in it, which is I've never. How can you? I didn't try it, but people still crave it, and I let them have it. But I think we need to go back to what we used to do. But like I said, eating fruits and vegetables. I think I digressed there for a little bit. I'm sorry, but I think fruits and fresh fruits and vegetables, those are very, very, very important. Eating fibers, eating cereals. We need to go with the food that have low glycemic index, meaning whatever we eat that it actually creates less amount of sugar. Mono unsaturated fats rather than trans, and then omega-3 fatty acids. Those things will help you to keep the heart healthy. Um, Again, uh, this shows the fruits uh, that how much fiber it contains. This is just a table showing us which fruit has how much fibers in it and how much should you be eating to maintain the healthy lifestyle. Eating apple a day is great. Banana, oranges, prunes, all of these fruits actually have uh, fibers in it, antioxidants in it, so that tends to help you to help your body stay healthy. Also, juices. I tend to tell people don't drink a lot of juice because juice is actually a concentrated. It has a lot of sugar in it, and then many times we tends to filter out the fibers from it. So if you can try to eat fresh fruits rather than actually drinking juice. Vegetables, definitely cooked vegetables, green beans, carrots, peas, potatoes. And then the raw vegetables, cucumber, lettuce, tomatoes, spinach. Um, so all of those things are going to help you. All of those things will help you to prevent the heart disease. The blood pressure, I think the last week we had a very good talk on blood pressure control. And I'll follow along with the same line where maintaining a healthy blood pressure is definitely is also very important. We define hypertension as blood pressure greater than 130 systolic and 90 diastolic. Again, the goal of the blood pressure differs because the guideline changes, and then based on your age and then the other comorbid conditions, there should be a set targeted blood pressure. But maintaining a good blood pressure definitely helps the heart. Definitely helps to prevent the coronary artery disease or having a cardiac event. Uh, Taking your medication is very, very important if you do have hypertension. And many times, I know a lot of times we say, I want to get off of all these medications if you can, which, as a physician, we do not want you to take as many medicines as, we also want you to take as least as possible, but whatever we're prescribing it because there is a reason behind it. Because if you don't control your blood pressure, then that's going to put a lot of strain on your heart. And the more strain your heart has to go because it has to pump the blood against that resistance. And then the weaker your heart is going to get, and it will be hard for the heart to pump the blood as time goes on. So it's very important. There are some non-pharmacological measures that you can do to control your blood pressure. That includes restricting your salt intake, avoiding the alcohol, losing weight, there is something called DASH diet, and I think it was discussed in the prior presentation. So if you take those steps, that's going to definitely help to reduce your blood pressure level. But also, please take your medications if you need them. Then comes the cholesterol. So the amount of fat intake, we should definitely be watching out for it, especially nowadays. We love eating out, we love eating pizza, we love adding cheese on every food that we cook, from being a dosa to a pani puri, like I said earlier, to having a double cheese on our cheese pizza. And so, you know eventually it will catch up to you if you continue to maintain that type of a lifestyle. So try to avoid it. If you do eat it, then work out, exercise, burn it off. Those things are going to make a difference. If you just eat all day and then sit at home and then watch TV, eventually it's going to catch up to you and it's going to make your life difficult. So there are types of fat that are good for you. There are types of fat that are bad for you. Uh, Especially trans fatty acid food, we should try to avoid because it increases the risk of coronary artery disease. Trans fatty acid is a type of a molecule that actually stacks really well together. As you stack on top of it, it actually forms a solid substance, and it actually forms, and that's why it forms, it can actually propagate where you're forming more and more plaques on your blood, on your arteries, and that eventually leads to a heart attack. Because it has a lot more LDL. What it does, it increases your LDL, it reduces the HDL. Whenever we are looking at the cholesterol, there are we look at three components. We look at LDL, we look at HDL, and we also look at triglycerides. The LDL is what we call uh, is a bad cholesterol. Then we have HDL, which is high density lipoprotein, which is a good cholesterol, and triglycerides are also the amount of fat content. Um, LDL tends to have a higher correlation with having heart attack. HDL is actually a good cholesterol, so higher it is, the better it is for you. So some of the saturated fatty acid that actually comes from the dairy foods like red meat and some plant oils, coconut and palm, uh, that also tends to have increases the total amount of cholesterol, that increases your risk of heart attack. Then there is also mono unsaturated fatty acid. Uh, those are your vegetable oils, those are your canola oils that and then those actually come from the beef, margarines, chicken, and olive oil. That tends to have no association as far as the coronary artery disease. Then there are unsaturated, polyunsaturated fatty acids, those that come from the sunflower oil, the corn oil. Um, those that actually those are found in mayonnaise. Those are found in margarines. Those are found in salad, some of the salad dressings, nuts, chicken, and peanut. Those tends to lower the LDL cholesterol and triglycerides and increases the HDL. Those will actually help you against the coronary. Those will help you for coronary artery disease, to prevent the coronary artery disease. Then there is also canola oil, soybean, flaxseed, walnut, wheat germs, vegetable oils, cabbage family. All of those things have linolenic acid. Again, these tends to help you because they reduces the coronary artery disease by lowering your LDL cholesterol, lowering the triglycerides, and maintaining HDL. Then we have a physical activity. Um, Nowadays, with the event of internet and having social media and having iPhone, we have forgotten the way we used to live life. As a growing up as a child, I used to actually go out and play so many sports. We've played kabaddi when I was a small child. We've played cricket when I was in India. We used to play football, volleyball. We've Many people, we've actually started doing these things, but we do it on our iPhones, we do it on our iPads, and we watch TV quite a bit. So our level of physical activity has gone down quite a bit, and that's what has contributed a lot to over time it catches up with you, and then you tend to develop coronary artery disease. So physical activities is actually recommended in the early school years and throughout our lifetime. We should definitely be involving in moderate intensity exercise at least 150 minutes a week, or vigorous intensity exercise 75 minutes a week. Even brisk walking is going to be helpful. So if you can't do these activities, then at least walk outside. Uh, Walking 3 to 4 kilometers, 2 to 3 kilometers a day is definitely going to help you. So So physical activity plays a huge role in preventing a coronary artery disease. And then comes the weight loss. As more sedentary lifestyle we're going to have, the worse it is going to be, because because more weight gain we're going to have. The more weight gain you're going to have, the more risk of premature coronary artery disease and having a death. Overweight and obesity definitely increases the risk factor for coronary artery disease, hypertension, high blood pressure, insulin resistance, development of the diabetes with time. Uh, so all of those things. So weight loss is definitely going to be a key component if you do have if you are overweight or if you are obese. And physical activity, watching your diet, calorie counting, those things makes a huge difference for weight loss. And the more weight loss you're going to have, the better it is going to be for you to reverse the coronary artery disease. And there are some recent studies that have shown that increased consumption of the coronary artery disease actually leads to a increased risk of increased consumption does have a correlation as far as having a coronary artery disease in the future. So drinking, limiting the amount of coffee that we drink. I know many people like to socialize, and I'm probably one of the. I also may tend to do that, where whenever we're going out with our colleague, we say let's just have a cup of coffee. But the coffee consumption does increase the risk of having cardiovascular disease. So I think we need to keep that in mind as well. And last but not the least, diabetes mellitus. Diabetes is a huge risk factor for coronary artery disease. The more uncontrolled the diabetes is going to be, the worse it is going to be. Diabetes is one of those diseases where it's like a slow poison where it's affecting every organ in your body. It causes coronary artery disease, it causes stroke, it causes peripheral arterial disease. It also affects your eyes, it affects your kidneys, it also affects your nerve fibers. Uh, so as the time goes on, it damages more and more. So whenever, if you do have diabetes, then watching your diet is very, very important. Try to stay away from the sweets, try to stay away from the carbohydrates that have a high glycemic index. Try to eat more leaner, try to eat food that are low in glycemic index. What that means is that the amount of sugar that is produced from that food that you're eating is less. So that's very, very important. Here I've listed some of the fruits and some of the food that in their glycemic indexes. And so what else can we do to aspirin has been so how what other things can we do to prevent the coronary having a cardiac event? Aspirin definitely helps to have a heart attack, and then the decision to take the aspirin should be based on the clinical judgment and to be able to see if the patient does have a risk factor for having a cardiac event or not, especially somebody who has diabetes, somebody who has high blood pressure. Aspirin a day will definitely help you out to prevent the myocardial infarction or stroke. Fish oil supplement studies have shown that the fish oil supplement also helps in preventing the cardiovascular disease. So it is appropriate to take them. And also, last but not the least, what about alcohol? There have been numerous studies done regarding alcohol intake, and the studies have shown that taking a small amount of alcohol does tend to help with coronary artery disease. That does not mean that people should be going out and consuming the alcohol. Again, there risk and benefit should be evaluated, if you should be drinking alcohol or not, because the side effects of other things that happens with the alcohol, because it does lead to an addiction. From the addiction, it leads to a lot of other diseases, like, first of all, number one is addiction. The other thing is more drinking leads to a liver problem going forward. So again, there are some studies that have come up and shown that there is a little bit of a benefit, but still I would try to avoid alcohol intake. And the lifestyle changes. So there are certain things, the Mediterranean lifestyles, being physically active, definitely helps preventing the cardiovascular disease. Uh, and there is also something called polypill that's available in the market, which combines antihypertensive with statin and aspirin. There are some advantages to the polypills, because it does increases the compliance, but there is also potential disadvantages, because not many people need to take all those pills together. That's the reason why they're not available in the United States and Europe. So we tend not to I would say, try to stay away from the polypills, and taking it individually is a lot better than actually going through a polypill. So again, taking aspirin a day definitely makes a difference in preventing the coronary artery disease. So in a nutshell, leading a healthy lifestyle, eating properly, controlling your blood pressure, controlling your diabetes, uh, having good exercise, having good family support, no smoking, that will help you prevent the heart disease from developing. And hopefully you won't have to go through an episode where there is an emergency and we have to take care of the patient. If you guys have any questions.
Great. Thank you so much, Doctor. That was a very informative session. And I especially have to say that I like the part where you talked about the different kinds of chest pain and how we can debug what kind of chest pains are there. So now we move on to the question and answer session. So what we can do is, to the participants, we have shared the Zoom link. Some of the participants have already come here. If you would like to ask the question directly to the doctor, you're welcome to come on Zoom. If not, I would say that you can post the question also on Zoom, and our team will be happy to. Our team, you can also post it on chat on YouTube, and our team will be able to pick the questions if we have time and ask the doctor. Before we move on to the question and answer, while the participants are moving from YouTube to Zoom, we have a couple of important announcements that we want to make. Very briefly, the first one is JKYog organizes a annual spiritual family camp and spiritual retreat, and usually we do it in the worldwide headquarters of JKYog, which is Radhakrishna Temple of Dallas. Considering the pandemic this year, for the first time and possibly for the last time as well, we are doing it on the virtual platform. It is going to be 7 days of blissful experience, soaking ourselves in devotion, bhakti, and devotion, bhakti. And of course, we get the opportunity to hear directly from Swami Mukundananda ji. There'll be beautiful lectures by him, question and answer session, interactive activities. There will be fun and as well as educative activities for children and youth. So please do register The family camp is going to be between August 4th to August 10th. And subsequent to the family camp, we are going to have the Janmashtami Mahotsav. And this is the global Janmashtami Mahotsav, again, once again, brought to you on the virtual platform. So 2 days between on August 11th and 12th, we are going to have very special bhajans, very special pujas, and of course, and we have like world-class cultural events lined up. So please do register for that. It's completely free event. The Janmashtami Mahotsav is completely free. Tomorrow and day after tomorrow, JKYog is organizing the youth conference from 9 a.m. Central Time until 5 p.m. Central Time. Lots of really accomplished speakers have been lined up, and a lot of fun activities have been planned for the youth. Everyone are welcome, and of course, Swami Mukundananda ji is going to be the keynote speaker. So there's keynote speech by Swamiji tomorrow, and there's also going to be a panel discussion with Swamiji on Sunday. So please do not miss this wonderful opportunity. And last but not the least, JK Yog is now offering Prem Yoga Teachers Training. And this is for the first time a 200 RYT a 200 RYT yoga teacher training program is going to be launched. It's already launched. 40 days, across 40 days, you can participate starting from August 4th along with the family camp. This Prem Yoga Teachers Alliance will be offered, and you're welcome to enroll in that. The website is you go to jkyog.org and you will be able to find the details of that as well. With that, we now move on to our question and answer session. So I do see a couple of hands up. Let's first go to Anshumanji. Anshumanji, I see your hands up. Please go ahead.
Yeah, thank you, Dr. Rumit, for the informative session. I have two questions. My first question is that is heart rate variability and quick recovery after any exercise an indication of good heart health? And my second question is what is the impact of stress on the heart health? Thank you.
Mute myself. Okay, can you hear me?
Yes, we can hear you.
Okay, so your first question was regarding as far as
heart rate variability. Heart rate variability.
Mm-hmm.
Does that indicate a good heart health?
So we say that the maximum heart rate. What is a person can achieve a maximum heart rate? So there's a formula we use. It's 220 minus the age is what's the maximum heart rate can we achieve. So that's the formula we use. So whenever you're exercising, and obviously when you're exercising, your heart is going to have a reflux, and then the reflux is going to cause heart to pump. The heart rate is going to be high. So the maximum heart rate that you achieve, and if you keep it for a longer period of time, that's where your aerobic exercises comes. Okay, so our heart always has a tendency to actually go high on the rate. Normal heart rate is anywhere between 60 to 100. Anytime whenever it goes more than 100, we call that a tachycardia. Okay, but then that we call it when you're resting it. So if you're resting if you're sleeping and suddenly your heart rate jumps up to more than 100, then that's abnormal. But when you're exerting yourself and your heart rate jumps up, that's definitely normal, because your heart rate is going to go high when you exert yourself. So a lot of times you will not go more than your target heart rate, which is 220 minus the age, right? So whenever it goes more than that, there may be something wrong with your heart or structurally, or you may start getting symptomatic at that point. But typically, having a variability in the heart rate with the exertion is a normal thing occurring. What was the other question?
What is the impact of stress on heart health?
So the stress secretes the hormones called catecholamines. Those catecholamines, that they actually come from our adrenal glands that we have that sits on the top of our kidneys, and those catecholamines will cause heart rate to go high. So definitely stress will always cause your heart to jump up. What's the overall impact of that stress, what's the overall impact. You can go into an arrhythmia. Many people have arrhythmia nowadays. We call that atrial fibrillation, which is an irregular rhythm of the heart. As we age, we tend to have those, and then we get into this rhythm where it's more than one, heart rate is more than 100. It's irregular, and it causes a lot of other problems. So definitely, stress is there. Stress causes a lot of problems. There is something called stress-induced cardiomyopathy. There is something called broken heart syndrome, which is, whenever we call that a Takotsubo cardiomyopathy. What that is more stress you have, then that leads to a vasospasm of the blood artery, and you could potentially have a heart attack from it. Right. So that's why, and that was a Japanese guy who discovered it. That's why it's known as the Takotsubo. Uh, but uh, but again, so that's happened before, and many times a lot of people we've seen that they have a lot of stress, and suddenly a family member passes away because they have sudden onset of cardiac death, but they don't have a coronary artery disease. Their arteries are clean. Whenever we autopsied them and whenever we looked at them, their coronaries didn't have any plaques in it. So how did that happen? That happened because of the stress. And stress causes catecholamine secretions in our body. Catecholamine not only increases the heart rate, it can also cause spasm of the blood vessels. And it can cause that spasm in the heart itself, which where the blood supply is coming from, can give you a heart attack, and patient can potentially die from it.
Thank you.
Thank you. Thank you, doctor.
Yes.
We now move on to the next question. That is from Swati Jain. Swati Jain, you can please go ahead. Sorry. Go ahead. Yes.
The session was very good. Now I want to ask, I have a cesarean delivery 8 years ago, and my digestive system was not working that time, and I have a meal. From that, I am suffering from ulcers. I have taken medicines also, but my chest pain due to gas and acidity is increasing day by day. So what should I do?
I'm sorry. I think you were your voice was breaking a little bit. Can you repeat your question?
I have a cesarean delivery 8 years ago,
Okay.
and I have a diet before my digestive system starts working.
Mm-hmm.
After the anesthesia I was given,
Mm-hmm.
from that my gastro intestine has ulcers.
Okay.
From then my chest pain due to acidity is increasing day by day.
Okay.
I have treatment for ulcers 2 times,
Mm-hmm.
but it does not works. So
Okay.
what should I do?
Okay. So you have ulcers, and then those ulcers tends to give you a lot of chest pain, and that happened after you had a C-section. That's what you're saying. Is that correct? Okay. So whenever you have an ulcer, as far as what I know, the cesarean sections does not cause gastric ulcer. Okay. Gastric ulcers are caused by number one, our diet. There is something called Helicobacter pylori. That's the organism, and I think in India, H. pylori is endemic, meaning that there is a lot of prevalence of that. Um, so first thing that you should do if you have an ulcer is definitely you need to take medication called uh, proton pump inhibitor. Those includes omeprazole, pantoprazole, dexaprazole. There's a Pepsid also. So we actually prescribe PPIs. So omeprazole is what I should say you should take. If you have already taken that and it has not gone away, then what I would say is probably you need an endoscopy and you need to biopsy that ulcer. And after the biopsy, we need to check and see if there is any Helicobacter pylori growing in there. If there is a Helicobacter pylori growing there, then you need to be treated for it. And there is a 4 different medication regimen that there is antibiotics and PPI combined together that needs to be given to you. And then if you take that for 2 weeks, then it will go away. So I think you need to see a gastroenterologist and possibly do an endoscopy and possibly get that biopsy, the culture done, and check for a Helicobacter pylori. That's what I would do.
Great. Thank you so much, doctor.
Okay.
we now move on to Smita ji. Smita ji, please go ahead and you can ask your question.
Um,
Yes.
I think is it okay to read the question?
I think your voice is gone.
Yeah, you're on mute. Smita ji, you can unmute it.
Okay.
Yeah.
All right, here we
Go
go.
ahead.
So what I was curious about was if somebody has no existing condition like a blood clot or any other reason, what besides plaque that you had previously talked about, what would be the reason that a person's heart would stop pumping and they'd get breathless very frequently until the heart actually stops functioning? I'm just trying to understand that.
So let me. So basically, few things that can cause heart to stop working, right? Number one is myocardial infarction that we were discussing, heart attack, plaque, no blood supply to the heart muscles, and then heart stops working. The other thing that would cause heart to stop working would be any kind of a malignant arrhythmias, right? So people, if you think about having atrial fibrillation, if your heart stays in that rhythm for a long period of time, if the heart is in irregular rhythm, tachycardic, and if you don't control it over course of time, it can actually go, as it tires out more and more, you can go into an asystole. So that would be one reason why I would say that can happen. So tachycardia induced cardiomyopathy that can cause it. Then somebody else was talking about earlier, having a stress can cause it, where you don't have a blockage and that actually caused to have a heart attack. Then we have our we have quite a few patient population that abuses drugs, right? Like cocaine, for instance. So if they're doing drugs, that drugs can actually have a spasm of the artery, and then that can cause you to sudden cardiac arrest, and patient can die from that as well. Uh, then I can say there is a respiratory cause as well, right? Having a pulmonary emboli, which means there is no blockages in the heart itself, but the pulmonary artery has a blood clot in there, and then it's having to pump against it, and then that can cause so sometimes we call that a respiratory code. Then there is also patients. There are many reasons why heart can stop working. There is a pulmonary cause where the heart can stop working as well, where people having COPD, asthma, if they are not controlled, then there is not a proper circulation, and then eventually, if the heart is not getting enough oxygenated blood, it can stop working as well. Then there is also a neurological cause as well. Somebody having a stroke, because all the centers are located in the brain itself. So if those centers die off, then you don't have any control on the heart. So that can happen. So there's
Great. Thank you, doctor. That was a very detailed answer.
yeah.
Yeah, there are a lot of questions coming in the chat box. So on behalf of one of the participants, the question that I would like to ask for the benefit of everyone is, can thyroid problems lead to heart problems?
Absolutely, it can, especially having hyperthyroidism. Hyperthyroidism, what that causes is thyroid level is high. Then when the thyroid hormone level is high in your body, it leads to tachycardia, meaning your heart rate jumps up. When the heart rate jumps up, if the heart rate stays higher for a longer period of time, eventually your heart starts going into a heart failure. It starts weakening up because the muscles are tiring, muscles are weakening. So there is definitely a thyroid-induced cardiomyopathy, and that's there for sure. Yes.
Great. Once again, thank you, doctor. So I think we are almost at the end of the session. So maybe we can take just one more question. So our last question will go to Bharat Thakurji. Bharatji, please unmute yourself. You have to unmute yourself, Bharatji. Yeah, please go ahead.
I didn't raise my hand. I have no questions.
You have no questions. Okay, wonderful. So then we can move on. We can take one question from, yes, Pradeep Kumarji. Please go ahead, Pradeep Kumarji. unmute yourself and you can ask your question.
Radha, madam.
Yes.
Good morning, Doctor. Sir, my angioplasty done in the year 2017 because there was blockage in one of arteries 90%. And after that, I am regular doing yoga, doing meditation, and I am on DIP diet since last 1 month. So can I stop the medicines now?
Dual antiplatelet, are you saying?
I am on DIP diet. DIP diet means I take fruits up to 12 hours. And after that, I am taking 2 plate diet. That is 1 plate in the vegetable and another plate is for normal meal.
Okay.
That I am doing for since last 1 month.
Okay.
So now can I stop the medicines? And I am also doing regular yoga practices and meditation, etc.
So you already have a coronary artery disease, okay? You have a stent put into your heart, and you said that stent was placed in 2017. Is that correct?
Yeah.
Okay. So there are actually 2 different types of stents we have. We call it a drug-eluting stents and bare metal stents. There is a reason why I'm mentioning that, because the reason is the drug-eluting stents these are the stents that are more viable. They can last in your system for a long period of time. But what happens with these stents is that you have to take your medicine for at least 1 year, especially the dual antiplatelet therapy, meaning aspirin and clopidogrel or aspirin or Efient or Brilinta. These are the medicines that you have to take. Because if you don't take those medicines for 1 year at least, the stents that's there will actually get thrombosed. If it does get thrombosed, you'll have another heart attack. So it's very important to take those 2 medications along with the statin and along with the metoprolol, which is a beta blocker. Those medications are indicated in patients with coronary artery disease. Okay, changing your diet and following a good healthy diet along with the exercise is a great thing to do, and that's definitely going to help you. But when you stop taking medications, especially when you already have the disease, uh, it's not advisable, because we tend to ask them continue taking aspirin. I think you're more than a year past since the stent placement, so you don't have to take 2 blood thinners. You can go by 1 blood thinner for sure. Okay, but you also have to keep your healthy diet. You still have to take the aspirin. You still have to take a beta blocker, and because there are studies after studies that we have done, and those studies have shown that not only it will have the life expansion benefit, it will have a good quality of life. We call that morbidity and mortality in medical terms. So I would say you already have a disease. You would continue taking these medications.
Great. Thank you so much once again, Dr. Rumit Thakurji. Really, it was a very informative session, and we're very grateful to you for taking time out of your busy schedule to do this webinar for the benefit of our people across the world. I really, really appreciate you doing that. And once again, I wanted to express our heartfelt thanks to Dr. Bal Kandalwalji for arranging all these sessions. Thank you, Dr. Kandalwalji. So with that, we come to an end to this Friday's health webinar series. We will meet again next Friday on a very interesting topic. See you then. Radhe Radhe.
Radhe Radhe.
Thank you.